right, to our special segment, People First, here on 8 p.m. Prime. And this is certainly news many people are going to be able to use, promising new treatment for breast cancer that's been pioneered by an Indian scientist in London.
Well, this may soon be available in select hospitals in India. It involves a much lower radiation dose and will provide cancer patients much relief. CNN have been Sanjay Suri and Shalini for that story.
London-based Indian oncologist Dr. Jayant Vaidya and two other doctors have come up with a breakthrough treatment for breast cancer that combines a single dose of radiotherapy with surgery, which should spare patients unnecessarily high doses of radiation and provide much relief.
It would mean that this lady could have her lump and the cancer removed at the time of the operation, during an operation. At the same time, she could be given the radiotherapy in the operation theatre. And that would complete her local treatment.
Dr. Vaidya, Jeffrey Tobias and Michael Baum developed a machine that inserts a probe into the breast to target the exact site of the cancer, unlike standard treatment that involves surgery and then weeks of radiotherapy that exposes the whole breast area to radiation.
In India, this treatment would be cheaper than giving standard treatment because the cost of the machine would be recoverable. My calculation on the back of the envelope, it would be recoverable within about 2 years if 50 patients are treated per year.
As part of the trial on 2,000 women across 9 countries, Dr. Vaidya has already used this new technique in Hyderabad. Meanwhile, doctors in India are excited.
The advantage is that the treatment lasts for 45 minutes and possibly it avoids radiation to the lung and to the opposite breast. The two main concerns are a longer follow-up is needed to look at the local recurrence, plus to see the safety of this one big dose of radiation to the breast tissues.
Doctors add that if the follow-up of the study does not show any other major side effects, this new technique will easily be the next big advancement in treating breast cancer.
This breakthrough means potentially the end of so much suffering for so many women. For Vaidya and his team, it ought to mean the Nobel. In London, Sanjay Suri.
And Dr. Jayant Vaidya is now joining us from London. Dr. Vaidya, many congratulations. This is being considered a huge breakthrough, but tell us just what are the hurdles going forward and the possible side effects. That's a concern as well.
Well, we have found that the side effects are actually less than what we would have with external beam radiotherapy, which is a good thing. Hurdles are going to be how this can be rolled out into the community, where one important point that is required for this is the machinery required to give this. What is good about this is modern technology which is less expensive than the conventional treatment. So in many ways, if the NHS or the healthcare system wants to save money, this is the way to go ahead.
Okay, you're saying lower cost, Dr. Vaidya. Also, what oncologists in India are very excited about is much less exposure to radiation. What's the difference really going to be?
Well, you see, the proof of the pudding is in the eating. We have found that the dose that we are giving is as effective as the standard treatment. The biological dose that we give, although the physical dose is small, is likely to be much higher and equal to the standard treatment. And it gives the dose to the correct tissues. It also may have an effect on creating a better microenvironment for the tumor.
Okay.
And therefore, we believe that the results are robust enough to go ahead.
Oh, all right. So Dr. Vaidya, how long before this does become standard treatment?
We have done a trial which we started 10 years ago. We have published the results in a renowned journal, and the results are conclusive enough for us to say that this should be considered as an option as an alternative to standard external beam radiotherapy.
But
the results we have are up at 4 years, which is past the time when the peak hazard of recurrence has occurred.
All right, Dr. Vaidya, you're sounding very positive there. Many asking also the question is, why is this research not done more of here in India? Is it really a matter, you think, given your experience in both countries, a matter of funding or expertise?
Well, it will be good for everyone in India to know that the idea about this research started to some extent simultaneously in India and in London, so in Tata Hospital. So in many ways, this research can certainly be done in India, and there should be no reason for it not to be done.
All right, Dr. Jayant Vaidya there in London. You've certainly given us a lot of good news, good cheer this evening. Patients, especially being treated for breast cancer, can take heart from. Thanks so much for joining us.